So basically, the chapter 3 part of the research methods. The chapter 3, if you are doing proposal, you are writing a proposal, you are writing the actual project work. The chapter 3 is what we've titled research methodology. And I think at this level, we've established all these things already. So when we say chapter 3, that's the research methodology. Under the chapter 3, these are the areas you cover as a researcher. Okay, on the basic level, we can just ask you, what areas will you cover as a researcher when you are writing the chapter 3 of a proposal? Is that okay? So what areas? List all the areas you have to cover when you are writing research methodology, or when you are writing the chapter 3 of a research proposal or a research work. So these are the areas. The introduction, which is the 3.1, 3.2, which is research design, 3.3, which is the study area, 3.4, which is the study sample, 3.5, which is sample size determination. We have 3.6, which is the study variables, 3.7, which is sampling procedure or sampling technique, 3.8, data collection instrument or tools, 3.9, data collection procedure, 3.10, data analysis, 3.11, validity and reliability. That is for quantitative studies. And for qualitative studies, you use what we call trustworthiness. Then we have 3.12, which is the ethical considerations. Okay, ethical considerations. And that's the last thing you talk about when you are doing the chapter 3 of a proposal or chapter 3 of an actual project work. Okay, so yeah, so if I ask you, what areas are you supposed to focus on or cover when you are writing research chapter 3? You should be able to list all these 13 areas. So introduction, research design, study area, study sample, under which we have inclusion criteria, exclusion criteria, sample size determination, study value. You should be able to list all these areas. Is that okay? Then beyond listing these areas, you should understand what goes into each area. And I think we've looked at research designs. Have we done research designs in your class? Have we done research design? Yes, we've done research design. So did we do the 3 common designs, the retrospective design, descriptive cross-sectional design, and prospective design? Have we done the 3 common designs? Yes, have we done the 3 common designs?
Yes.
Good. So retrospective design, descriptive cross-sectional design, and then prospective design. And did we do the 3 common approach, data collection approach?
Yes, please.
Yes,
Good.
sir. Yes,
So
sir.
what are the 3 common data collection approaches?
Yeah, the qualitative,
Quantitative, and
Good.
method.
So the quantitative, qualitative, and mixed method. Is that okay? And I think in your class, we've also done the study area or study setting. Have we done study area or study setting?
yes, please.
Good. We've done study area and study setting. Yes. So we've done study area. I even added the study site. So I taught you study area, study setting. And I went further to even teach you study site. And I told you whichever one is in your guideline, that is what you write. So you see in your guideline, we have study area or setting. So you can choose to write on study setting. And I told you study setting includes the study area plus the site together. That is for those of you who will be doing facility-based studies. For those of you who will be doing community-based study, the study setting will basically just be about the study area. Is that okay? Understand all these dynamics. Okay. Your class, I don't think, have we done the study sample? Have we done study sample?
No, please.
We've not done study sample. That is fine. We will do study sample in person in our last meeting, probably on when is it on Tuesday? On Tuesday. Yes. Have we done sample size determination?
No, please.
We've not done sample size determination. We've not done steady variables, but steady variables is very simple. Provided once you know dependent and independent variables, steady variables shouldn't be difficult. It's the same thing. Good. Have we done sampling procedure and sampling technique?
Yes, please.
Good. So the two types of sampling procedures, the probability sampling, non-probability sampling, under probability sampling, simple random systematic sampling, cluster sampling, stratified sampling. Under non-probability, we discuss convenience sampling, purposive sampling, quota sampling, snowball sampling. Okay, good. You should know all those sampling techniques. Have we done data collection instruments? Have we done data collection? We've not done data collection instruments.
sir.
Good. So today we will do the data collection instruments. We will do data collection instruments. Then we will do validity and reliability. Then we will also do the ethical considerations. Then when we meet in person, we would end the semester with data analysis technique, data collection procedure, and then I'll also take you through the steady variables. Then we will do some few revision. We look at some few areas you have to consider for your revision exercise. Okay, so let's look at data collection instruments. Data collection instruments. So you can write your notes. Data collection instruments. In some literatures, they call it data collection tools. Okay, when we say a data collection tool is more like the device that you use to collect data for your study. So when you are going to do a research, the device that you are going to use to get information to answer the questions that you asked, that is what we call data collection tool. Is that okay? An example of a data collection tool is a questionnaire. So you see, sometimes you'll be in class, they will bring questionnaires, and then they will share them to you. Then you are taking there. It's a data collection tool. Data collection, what are they using to do? They are using it to collect information from you. What are they going to use that information for? To go and answer their research questions. That's what we call data collection tool. Is that okay? And that is what we call data collection tool. Now, the choice of data collection tool depends on the type of study you are conducting. This point is very important. The choice or your selection of a data collection tool depends on the type of study you are conducting. So let's start with, so now you know what data collection tool means. A data collection tool is more like a device that you are going to use to collect data from or information from the participants in your study. So when we ask you what is a data collection tool, it's a device that you are going to use to collect information or to get information to answer your research questions. That's what we call data collection tool. Is that okay? So let's go to the slide. Okay, so it's any device, it could be a form, it could be any system. Is that okay? That the researcher is going to use to gather information from your participants. That is what we call data collection tool. But what you should remember is, you see, in research, when you are writing anything, you have to think beyond the box. So not just because it's not all study you collect information from participants. Then someone can question that, okay, then say, how about retrospective studies? You know, it's not all retrospective studies. There are some retrospective studies you review data from existing records. Okay, so you see, that's why we are using the word sources, because it's not all studies that you collect data from participants or respondents. Some you collect them from already existing records, like the retrospective studies. Is that okay? Great. So when we say data collection tool, this is a device or any system that you are using to gather information from your participants or collect data or information from sources. That's a data collection tool. You can also call it data collection instrument. So when we say data collection instrument, any device, any form, any system that you can use to gather information or get information to answer your research questions or get information from your participants to answer your research questions. That's what we call data collection instruments or data collection tools. Is that okay? Great. Data collection tool. Now, one thing that you have to notice that when you are designing a questionnaire, your data collection tool have to align with your objectives. Let me take that point again. When you are designing a questionnaire, your data collection tool, it always have to align with your objectives. So keep it in your mind. It's your objective that you use to design your questionnaire. Okay, let me give you an example. Let's go to this study. Let's go to these objectives. Let me give you an example so that you appreciate that statement. So you see this research. Look at this research. Look at the specific objectives. To assess nurses' perception of strategic leadership practices at Korle Bu Teaching Hospital. To examine strategic leadership practices among nurse leaders in retaining nurses at Korle Bu Teaching Hospital. To identify leadership factors. Now, how many teams do you think we are going to form from this objective? How many teams? How many teams are going to be formed from these objectives?
4 teams.
Yes, 4 teams. 4 teams. How do we get the teams?
The specific objective.
No, but how do we get the teams? How do we form the teams? For example, in exams, if I give you these objectives and I tell you to write them in teams, it's something simple you should be able to do. How do we do it?
So, sir, you take the initial sentence, which is to assess.
Excellent. Yes, that's the right answer. That's the perfect answer. It shows you know what to do. Yes. So you take away the action verb to assess. So it's simple as that. Oh. Yes, you take away the action verb. And these are things you should expect in your exams. Oh. So these are basic things. Expect them. Yes, so you take away the action verb. When you take away the action verb, again, the lady that responded, what other thing do you have to take away? I gave you all the things you take away to get the team. Yes, which other thing do you take away? Good. You take away the setting. So you take away the action verb, then you take away the setting, and then it becomes a team. So it means from this first objective, the team will be nurses' perception of strategic leadership practices. When you come over here, if we ask you to form a team from this, the team, you are going to take away the action verb to examine. So strategic leadership practices among nurse leaders in retaining nurses, then you take away the setting too. You delete it from there. Then it becomes a team. If you want to use this to form a team, you take away to identify. Then you come and take away the at Korle Bu, then it becomes a team. If you want to use this to also form a team, you take away the to recommend. Is that okay? You take them away. So once you remove the action verbs, it becomes a team. Now, what we are saying is that when you are designing a questionnaire, the sections of the questionnaire should align with your objectives. Okay, so, but then every questionnaire or every instrument usually have a compulsory section. That compulsory section, we call it the demographic characteristics of respondents. Okay, so what it means is that if for example, if we are going to use this to design a questionnaire, let me show you how it's going to be like. We are doing it practical. Let me show you how it's going to be like. We are going to design a questionnaire for this study. How it's going to be like. We are going to design an instrument. Can you see my screen?
Sir.
Can you see my screen?
Yes, sir.
So which one is the compulsory section? Which part is the compulsory section? When you are designing a questionnaire, which part is the compulsory section? Yes, when you are designing a questionnaire, which part is the compulsory section? That's section A. That's what we call the demographic characteristics. That one, nobody should tell you, enter it. You see, when I open my document, that's the first thing I've entered. That one is compulsory. Every questionnaire should have demographic characteristics of respondents. That's where you are going to put their ages, their sex, the nationality, the religion. That is where you are going to put all those information. They are compulsory sections. Now the section B. The section B, you see, look at how I'm creating the section B. The section B, look at what I will do. I'll go back to the work. I'll go back to the work. I'll copy this objective. In fact, let me just copy all to save our time. So this is the objectives of the study. You see, I've copied the objectives of the study. So I'll just copy the objectives of the study, take it to the questionnaire, then let me paste it over here. Now, this one will become my section B. Now, I will change the objectives into a team. So you see, I've changed this one, section B. So you see, section nurses perception of strategic leadership practices. Then that's my section B. Section C.
Please, I can't see your screen.
Oh, are you sure? Please. Is it a situation for all of you?
No, please.
No, please.
Yeah, so kindly try and rejoin. Keep rejoining. It will work. So that's section C. Yes, so I'll clear. You see, I'm clearing there. I'm turning it or changing it into a team. Now, section D. You see the section D, I'm changing this one into a team. Leadership factors. Good. So you see, I'm changing all the objectives into a team. Okay, then let's come to section E. We are going to have section E. Section E. The section E2, leadership-driven strategies to improve nurses' retention. Then I'll clear there. So now you see how I've created the sections. You see how I've created the sections. And that is why we are making that statement that the data collection instrument should align with your specific objective. What it means is that, and I've established that every instrument has a compulsory section. Which one is a compulsory section?
Section A.
The section A. And what's the title of the section A? That section, what is the title?
Demographic characteristics.
The demographic characteristics of respondents. Now, if you go back, every questionnaire you see that section will be there. That section is not coming from your objectives. That section is a compulsory section for almost all questionnaires. Is that okay? Now, the other section should align with your specific objectives. So you see, section B, it should align with your first specific objective. Okay, so if you look at the section B, the questions under. So you see, under every section, you are going to set questions. So let me change. It's going to be something like this. So it's going to be something like this. So let's change all the sections will be in caps. All the sections will be in caps. So let me change all of them to caps. So it will be like this, and you will centralize them. Is that okay? So we will centralize this one too. We will come in. So you see, we've centralized all of them. Then you centralize it. So this is how we design instruments. Then under the section A, you set about 5 questions. So question 1, question 2, question 3, question 3, question 4, question 5. So let's assume we've set questions. So when you come to the section B, over there you are going to set questions under this theme. So nurses' perception of strategic leadership practices. So what questions you will sit down as group members. Then you ask yourself, what questions can help us to answer that objective? Is that okay? What questions do you think you can ask so that you get information for that objective? Then at least you set some questions under that objective too. You set some questions. Is that okay? Now, usually you shouldn't set less than 5 questions. For if it is quantitative, at least you should do more than 5 under each section. If it is a quantitative study, At least you do more than 5. Probably you can consider like 8 to 10 under each section of the questionnaire or instrument. Okay, so you set questions. When you come to the section C, that over there you set questions. So you are going to have questions 1, 2, 3, 4, 5. You see how I'm doing it. So you see, I'm creating the section. You see, I'm creating the sections of the questionnaire. Here you have 1, 2, 3, 4, 5. Okay, good. Here we are going to have 1, 2, 3, 4, 5. So you see how I've created a section. So you see, this is how the questionnaire will be created. Is that okay? Now, with this idea, let's go to the person's questionnaire. Let's quickly go to the person's questionnaire and see how the person have designed the questionnaire. You see it will align with what we are trying to do. So look at how the person have designed the questionnaire. So you see, this is the questionnaire. Practically, this is the person's work. So you see the sections, you see, this is the questionnaire. So now look at the section A. Demographic characteristics of the respondents. Section A. Now let's go to the section B. Look at the section B. Nurses' perception of strategic leadership practices. So you see, all the questions under it is aligning. So you see, they are having about 10 questions under that section alone. So you see, all the questions here are aligning. They align with that objective. Then the section C is also just like we were trying to do. The same thing. They will have the section D. Okay, and you see the section E is also there. Leadership-driven strategies to improve nurse retention. This is how we create questionnaires. And that's why, so the sentence is one sentence that we're explaining. So they are saying that when you are designing a questionnaire, it should align with your specific objectives. Let me take you to this one. Let's look at this study. Look at how many objectives are you seeing here? Look at this research. How many objectives can you see? How many objectives can you see?
4 objectives.
4 objectives. So if these researchers, if they are designing questionnaire, how many sections are you expecting to see?
What section?
Yes. How many sections are you expecting to see?
4 sections.
Why 4 sections? No, it means you've not gotten it. 5 sections. Yes, 5 sections. Why 5 sections?
Because that's like the compulsory part.
Good, because there is a compulsory section which is not part of the objective. That's the demographics. So this instrument, these people, if they are designing an instrument, they will have 5 sections. The question is, where is the 5th section coming from? That's the section A. That is a compulsory section. Every instrument. So what we are saying is that the instrument should align with your objective, but we have a compulsory section, which usually is the demographic characteristics. So, okay, so for example, if someone is doing a research and the objectives are 3, how many sections will you expect to see in the instrument? 4 sections. Yes, 4 sections. Why 4 sections?
Because there's a compulsory demographic.
Yes, there's a compulsory section, which is the demographic, which is not part of the objectives. Okay, so for example, so for these researchers, okay, the section B, what will be the heading for the section B of their research? Look at the objective. What will be the heading for the section B of their research?
Knowledge of pregnant women regarding resource incompatibility.
Excellent. Knowledge of pregnant women regarding resource incompatibility. That is excellent. Yes. Yes. So the section B. So it means that the first section A, we've reserved it. Every researcher, the instruments, the first section A, we've reserved it for data collection and demographic characteristics. You can't change it. Every instrument, if you go and download that, every data collection instrument, the first section, they will reserve it for demographic characteristics. Now, the section B have to align with your first specific objective. The section C have to align with your second specific objective. The section D have to align with your third specific objective. And if you have a fourth specific objective, the section E would also align with the fourth specific objective. Okay, if someone is doing a research and the person is having two objectives, how many sections will you expect to see in the instrument?
3.
3. Why 3?
Because the section A is a
Good, because the section A is a compulsory part. That is all that we are talking about. Is that okay? So you see, when we say an instrument, when you are designing a data collection instrument, it has to align with your objective. This is what we are talking about. So you see, every instrument, so let's look at this instrument. You see their objectives. Let's go to their questionnaire and go and see the magic in their questionnaire. You see their questionnaire. So if you're a supervisor and you check and the session is missing, then you tell the student, I didn't see your session A, demographic is not there. Go and redo the instrument and bring it back. You first of all have to at least glance through the sections. So here you see we are expecting how many sections? 5 sections, because they have 4 objectives. So look at the section B, you see knowledge of resource factor incompatibility. You see it's there, section B. The section B is coming from which objective? Objective number 1. You see it's aligning. Is that okay? It should align. Is that okay? Good. Let's look at the section C. Look at the section C. Attitude towards prevention and management. Is that okay? So you see this one is also aligning with the objective number 2. It has to align. That is it. Okay, that's section C. Let's look at section D. You see the perceptions. Perception regarding resource incompatibility. And that's why we say your instrument, your data collection instrument has to align with your objectives. Some books, they will say research questions. It's the same because you see, it's the objective that you change to research questions. And I taught you how you can also change the research questions into teams. You can also change the same research questions into teams. You can even change the research questions into specific objectives. So learn how to do all those changes. When we give you research questions and we ask you to change it to specific objective, you should be able to do it. When we give you the specific objective, change it into research questions, you have to do it. Okay. But over here, for the data collection instrument, the point we are looking at is that the instrument has to align with a specific objective, meaning the sections have to align with your specific objective. Meaning if you have one specific objective, your instrument will have 2 sections. Section A is compulsory. If you have 4 specific objectives, your instrument will have 5 sections. Section A is compulsory. That's demographics. Is that okay? So basically, this is what we are talking about. Is that okay? Good. So basically, this is what we are talking about. Let's go on or back to our points. Okay, so you see this study. Look at this and a typical example. You see demographic characteristics of data, knowledge on the topic, attitudes or practices. So here we are giving you an example of how you can section data collection instruments. Is that okay? Now let's start with quantitative studies. If you are going to do quantitative study, what instruments can you use? So you can write, if you are going to do quantitative studies, what instruments can you use? If you are going to do quantitative studies, what instruments can you use? You can write it down. Then I'll give you the instruments that you can use for quantitative studies. Now, when people are doing quantitative studies or researchers are doing quantitative studies, the common instruments they use is a questionnaire. Sometimes we call it structured questionnaire, so you can write. When researchers are doing quantitative studies, the commonly used instrument is what we call structured questionnaire. Structured. So when you are doing quantitative studies, the commonly used instrument is structured questionnaire. When we say structured questionnaire, you see what we were doing. Look at what we are doing. You see, we are not just, did we just write? How many questions can you see over here? You see here we have 5, 5, 5, 5, and 5. We have about 25 questions, right? You see, we didn't just write all the questions without putting them into sections. Can you see that? You see, we've sectioned the questions. That's what we mean structured questionnaire. Structured meaning we place the questions into certain sections. That's what we call structured questionnaire. Okay, so when we say a structured questionnaire, so you see, for example, if I had a questionnaire like this, let's say I design my questionnaire like this. Let me give you an example. So this time, okay, so questionnaire like this. Then I don't put them into sections, so I just start numbering. So if it is 20 questions that I want, I'll set all my 20 questions. That is an unstructured questionnaire. It's not commonly used in research. Some people can use it all right, but it's not the best. In research, we want you to work with the structured questionnaire. So if you are going to do quantitative study, the commonly used instrument is what we call the structured questionnaire. When we say structured questionnaire, what does it mean? Who can explain? When we say a structured questionnaire, what does it mean? Yes, when we say a structured questionnaire, what does it mean? Yes, when we say structured questionnaire, what does it mean? What did I say about structured questionnaire?
I want to try.
Yes, try. Go ahead, try.
Okay, so with the structured questionnaires,
Good.
it means each section has its own questions.
Good. So it means we've divided the questionnaire into sections, and each section is having its own question. We've not loaded all the question one. Is that okay? So someone can design a questionnaire, won't do any section, or if it is 25, all once, no section in the questionnaire. That one is an unstructured. The questionnaire is not having any structure. Is that okay? And usually unstructured questionnaires too, sometimes they do open-ended questions. Open-ended questions, meaning questions that you don't give the participants options to choose from. Unstructured. But in quantitative study, we do what we call structured questionnaires. That's the best. That's the commonly used. Fine, sometimes some people will use unstructured, but the best instrument to use in quantitative studies is the structured questionnaires. But then we even prefer you use structured questionnaire with close-ended questions. Now, let me explain. When we say close-ended questions, what it means is that you see sometimes people will bring questionnaires to your class. They've given you the question, then there is option for you to choose, like MCQs. That's what we call close-ended questions. The reason why we call it close-ended question is that you don't have the opportunity to write your opinion. You only choose from what the researchers have given you. That's why we call it close-ended questions. Is that okay? So when we say structured questionnaire, a structured questionnaire, it usually has structured sections. It has a structure. So if it is 3 sections, 3 sections. If it is 4 sections, 4 sections. Each section has its own question. And again, it's made up of close-ended questions. That's what we call structured questionnaire. Okay, so most people doing quantitative studies, the instruments they use is structured questionnaire with close-ended questions. Structured questionnaire with close-ended questions. There are some researchers that they may choose to use what we call semi-structured questionnaire. Okay, semi-structured questionnaire. And one of the characteristics that make a questionnaire close-ended is when you are giving the respondents options to choose from, like the way we do MCQs. You see MCQ, we set the question, then we give you options that you have to choose from. That's how MCQs looks like. That is how structured questionnaire with close-ended questions looks like. Okay, so structured questionnaires with close-ended questions. So if we ask you what is the best instrument to use for quantitative studies, what would be your answer? What instrument is the best for quantitative studies? What would be your answer? Yes. What instrument?
Structured questionnaire.
Good. And when we say close-ended questions, what does it mean? Questionnaire with close-ended questions, what does it mean?
It means the questions come with options that participants have to select from.
Good. It means the questions comes with options from the researcher himself that the participant have to choose. And again, the participant do not have the option to write their opinion. That is when we say it's a structured questionnaire with close-ended questions. Meaning we've set a question and we've given you options to choose. So it's close-ended. Is that okay? And that's what we say structured questionnaire. So when you say you are going to set questionnaire with close, it means you are going to set questions and give people options to choose from. So if you are bringing me a questionnaire and I ask you, okay, what type of questionnaire? Is it close-ended or open-ended? If you say close-ended, it means your questions, there are options for me to choose. So if they bring questionnaire to your class, ask them, is it close-ended or open-ended? Yes. If they say close-ended, then it means they are doing quantitative studies, meaning they have given you options for you to choose from. Okay, structured questionnaire with close-ended questions. And I told you some researchers can also do semi-structured questionnaire. When we say semi-structured, it means that it could be the questionnaire is not having sections. Or two, it could be they have mixed close-ended with open-ended questions. When we say open-ended questions, let me show you an example. We use open-ended questions in qualitative studies. In qualitative studies, we don't use questionnaire. So please listen. If you are in future, those of you who do qualitative, those people that you do interviews, you won't use questionnaire. You use interview guide. In interview guide is a structured interview guide. Remember, I've explained the word structured to you. Structured means you place the instrument into sections. Okay, so let's look at this interview guide. Look at this interview guide. Look, you see, this person did a qualitative study. You see, they've not given options for you to choose from. You see, they ask the question, they put dash there, then you write your answer. Look at this question. Can you describe your experience as a palliative and oncology healthcare provider caring for patients with cancer? You see, they've asked the question. So this question, they are going to ask it to do interview. So the paper will be in front of the researcher. Then they ask, as you are answering, they are recording. It's not like they are going to give you paper to write your answer there. But there are some researchers, they are doing quantitative study. Then they will miss some of these questions. Their instruments, you can't call them structured questionnaire with close. You call them semi-structured. Why is it semi-structured? Because they've missed an open-ended question. They've missed it with a close-ended, so it's not structured anymore. What is making it unstructured is the fact that they've combined an open-ended question to a close-ended question. So some researchers too can do that, but it's not the best. If you are doing quantitative study, the best is to do structured questionnaire with close-ended questions. Okay, but one, again, I gave you two things other researchers can do, which is not the best. Some researchers can decide to do semi-structured questionnaire with both close-ended and open-ended questions. It's not the best. Some researchers can also choose to do unstructured questionnaire. Unstructured questionnaire meaning they've not sectioned the instruments. Is that okay? They've not sectioned the instruments. Okay, so when you are doing quantitative study, the best instrument to use is what? Structured questionnaire with close-ended questions. That's the best. But apart from the best, which other alternative can other quantitative researchers use? When you are doing quantitative study, the best is the structured questionnaire with close-ended questions. Which other alternative can researchers use, which may not be considered the best, but they can still use it? Yes. The semi-structured questionnaire. And what makes a questionnaire semi-structured?
A questionnaire with
Yes.
close-ended and open-ended questions.
Excellent. A questionnaire with both closed-ended and open-ended questions. It will make it unstructured. And which other questionnaire, apart from the semi-structured, which other questionnaire can also be used, which is not really accepted in quantity, but they can use it anyway? Which other one is that?
Unstructured questionnaire.
Good. Unstructured questionnaire. And when do we say a questionnaire is unstructured? Yes, when do we say a questionnaire is unstructured? Yes, when do we say questionnaire is unstructured?
The questions are not grouped under sections.
Good. Simple as that. The questions are not grouped under any sections. So you see, if the researcher is asking 20 questions straight, all the 20 questions messed up in the questionnaire straight, no sections. Okay, and sometimes unstructured, they may even miss close-ended, even with. But the key point is that the questions are not. So if you take someone's questionnaire, and you see the questions are all mixed together, they are doing an unstructured questionnaire. But if you take, so for example, this one, what do you think? What name will you give to this instrument? Yes, this one. Look at it very well before you answer. Section A, background information. Look at the questions. Look at the nature of the questions. Section 2, look at the nature of the sections. Pay attention very well. What name are you going to give to this instrument? Yes. What name are you going to give to this instrument?
Semi-structured questionnaire.
Yes. What name are you going to give to this instrument?
Semi-structured questionnaire.
Yes.
Semi-structured.
Why are you calling it semi-structured? Can you explain?
So please, in each of the sections, the questions there is open-ended.
Good. But I like your idea for telling us that this one is, I've not taught it yet, so I won't blame you. This one is an interview guide. So here you call it a structured interview guide. Now, we use interview guide when you are doing qualitative studies. So those of you who do research that you interview and record the interviews, you use interview guide. The interview guide, we have structured interview guide. So you see here, they've structured because you see section A is there, then questions under section A. Section 2 or section B is there, then questions under section B. You see, so they've structured. So this one, this person did qualitative studies. In qualitative studies, we use interview guide. Okay, keep it in your mind. In quantitative study, we use questionnaire. Questionnaire can be in 3 forms. Structured questionnaire. What does it mean? It means, so you see, look at this one. You see, all the questions are open-ended questions. Once you see a questionnaire like that, straight away, it should tell you the person is doing qualitative studies. So you see, look at all the questions. See, all the questions are open-ended questions. Look, you see, this question is an interview guide. The reason why we are calling it interview guide is you are going to use it to do your interview. So we call it interview guide. So when you are sitting there with the person, you'll be watching on it. Then you ask the person, how old are you? Okay, then the sex, that one you not ask, because when the person is sitting there, you see. What's your marital status? You ask. What's your religion? You ask. What's your level of education? So as you are asking, then the person is also giving you the response. Then you are recording the person. Okay, and the person will give you consent before you do all that. When you finish, you come to the session 2. Okay, can you please describe your experiences as a palliative and oncology healthcare provider caring for patients with cancer? Then the person starts answering. As they are answering, you are paying attention, and your device is also recording. When you finish, you come back home, come and transcribe all the recordings verbatim. Is that okay? That is an interview. So this one, we call it interview guide. You see, interview guide. But this one is a structured interview guide. Why is it a structured interview guide? It's a structured interview guide because, see, it's in sections. You see, it's in sections. It's in sections. Is that okay? It's in sections. Let's look at this one. Then you tell me which device was used. Okay, look at this one. Which instrument, which type of questionnaire is this one? Or which type of instrument? Look at it very well. I'll go through all the sections. Then you tell me what you think, what instrument you think it is. Look at all the sections and look at the questions. Pay attention to all the questions too. Pay attention to all the questions there. Okay, so we are done going through the questions. So this is the section D. Okay, what type of instrument is this? Yes, what type of instrument is this? Per your observation, what type of instrument?
Structured questionnaire.
Structured questionnaire, is that all? There should be more to add.
Semi-structured with
With
closed-ended
close-ended questions.
It's a structured questionnaire with close-ended questions. Is that okay? Get it too. It's a structured questionnaire with close-ended questions. Is that okay? Structured questionnaire with close-ended questions. Have you gotten it now? Please, have you gotten it now?
Yes, please.
Good. It's a structured questionnaire with close-ended questions. Is that okay? So pay attention. It's a structured questionnaire with close-ended questions. Is that okay? Structured questionnaire with close-ended questions. Structured questionnaire with close-ended questions. Is that okay? So you see, there is no question that they've asked for you to give options, for you to express yourself. So all the questions, they've provided options. So you call it a structured questionnaire with close-ended questions. So if you see a questionnaire like this, what will come into your mind? What type of study do you think they are doing? What type of research do you think they are doing?
quantitative.
Good. Quantitative studies. Yes, quantitative studies. Quantitative studies. Okay, so let me ask you this question. If someone is doing a research and it's a mixed method study they are doing, quantitative and qualitative, how would their data collection instruments look like? Who can try? Their data collection instruments. What are you expecting to see? Yes, who can try?
Close-ended questions.
So, no, don't say it that way. I want you to say it in a professional way. Now, I don't want you to say,
semi-structured sections. Questionnaire.
Okay, why semi-structured?
Because it's going to have both closed and open-ended questionnaire.
That is not what makes it semi-structured, though. That is not the only element that makes it semi-structured. There are several things that makes a questionnaire semi-structured. So the semi-structured could mean the questionnaire, all the sections you're expecting to see, they didn't consider it. That is one. Again, they are using both closed and open-ended questions. That is two. Okay. So for it being semi-structured, it's not only about it having closed-ended and open-ended questions alone. Okay, someone else wanted to say something. Yes, go ahead. Yes, someone wanted to respond. Go ahead. Now, the question I'm asking is, if someone is doing a mixed method study, what instruments are you expecting in the person's work? Someone is doing both quantitative and qualitative study. What instruments are you expecting in the person's work?
You see a structured questionnaire.
Good. Someone has answered my question. Yes. Both questionnaire and interview guide. Simple as that. Both questionnaire and interview guide. Yes. Yes. Both questionnaire and interview guide. So it's because we use interview guide in qualitative. Is that so? Here you put the structured and unstructured. But if someone is doing mixed method, of course, when you open, you should see a questionnaire and an interview guide. Why? We use questionnaire in quantitative. We use interview guide in qualitative. That's the first thing. Up to whether the interview guide, the person who make it structured, is a different thing altogether. And up to whether the questionnaire to the person who make it structured is also a different thing. But the primary thing is that once the person is doing a mixed method, we are expecting to see both questionnaire and an interview guide. Let's look at an example. Let me see whether I have a project work like that. And let me show you an example. Abraham. So look at this research. Look at this one. Let's look at their instruments. Look at how their instrument look like. So you see, look at their instruments. You see, Look at how their instrument look like. So you see section A. You see section A. Look at the questions they are asking. You see all the questions they've given options in section A. Look at section B. Section B is also quantitative. So you see that one too. All the questions they've given options for you to choose from. Look at section C. You see they've even written that qualitative aspects, and they've even indicated open-ended questions. The section C. So you see the section C. You see the questions when they ask, they put space there for you to give your opinion. It doesn't mean you are going to write your answers there. If you see instruments like that in purpose work, it doesn't mean you are going to write your answers there. All it means is that they are giving you options. It's like they are going to ask you the question. As you answer, they record you. So if you go and take someone's project, you see questions like this and comma is there. It doesn't mean they will ask the question, then they give you pen for you to write your opinion. No. That's why we call it interview guide. So they will ask you the question as you are answering, they are recording. That's what we use it for. Is that okay? So if you see someone's work, the instrument or the question, and you see, the data collection instrument, and you see it's having questions like this, in addition to close-ended questions, automatically you should ask the person, did you do a mixed method study? It's a mixed method study. Either than that, you should question the person. That how come it's not a mixed method study and you are having open-ended questions? Can you explain? Then unless, and that is where the deficit will come in. That's why I was telling you, for people doing quantitative studies, the best is the structured questionnaire with close-ended questions. But you can have some researchers, okay? You can have some researchers that they will do semi-structured. What semi-structured means is that you see sometimes you are answering some questionnaire. It's like all the questions are close-ended questions. Then the last question, then they will ask, what do you recommend? You see, it's like one question that they've left that you have to write. That one is a semi-structured. It's just one question, but it shouldn't be more. If it becomes more, it becomes a mixed method study. So sometimes you are answering some questionnaire. All the questions are close-ended questions. Then it's like the last question they will ask, what do you recommend? Then they will leave an option for you to write. That one is what we call semi-structured questionnaire. Why is it semi-structured? They've added something else from interview guide, a characteristics from an interview guide to it. Is that okay? And that is what we call that is a semi-structured questionnaire. The semi-structured questionnaire. Okay. The unstructured questionnaire, on the other hand, that one is like you've just set your questions. You didn't put them in structures. You didn't section them straight. Is that okay? If it is 20 questions, all the 20 questions, you see them straight, no sections. Is that okay? Yes. So if someone is doing qualitative study, what instrument is the best? Qualitative study, what instrument is the best? If someone is doing qualitative study, what instrument is the best?
Interview guide.
Structured interview guide.
Good, structured interview guide. But so now you know the best. That's how we learn. But apart from the structured interview guide, what do you think another researcher can do? Which may not necessarily be appropriate. Yes.
Unstructured.
Who can? Unstructured interview guide. Is that okay? Unstructured. So if you search, you see we have another type of interview guide we call unstructured interview guide. What would that tell you? What do you think that will mean? Unstructured interview guide. What do you think that will mean? They won't put it under any sections. So it's like if it is. So you see here, they have questions under perception. They have questions under clinical experience. If it was an unstructured interview guide, they will put all the questions together. If it is 15 questions, all at once. Let me go to this one for you to understand it properly. So you look at this ladies' work. You see, they have questions under experiences. They have questions under the factors. They have questions. If it was unstructured interview guide, if it is 15 questions, all the 15 questions together, no sections. Then we call it unstructured interview guide. Is that okay? So if someone is doing quantitative study, what instruments can the person use? What type of instruments? What 3 different instruments can the person use? And which one is the best? Yes. Yes, questionnaire.
Structured questioning. Unstructured
Structured
questioning.
questionnaire. So structured questionnaire with
Structured.
close-ended questions. Okay. Any other instrument that can be used?
Semi-structured questionnaire.
Semi-structured questionnaire. Excellent. Semi-structured questionnaire. Good. Any other instrument that can be used?
Unstructured questionnaire.
Unstructured questionnaire. That is great. Okay. If someone is doing qualitative study, what instrument is the best? And apart from that, which other instruments can be used?
That is the best should be the structured interview guide.
Structured interview guide. But apart from that, which other one can other researchers do?
Unstructured
Structured
The
interview
interview
guide.
guide.
unstructured interview guide. When we say structured interview guide, what does it mean?
It means the questions are in sections.
The questions are in sections. Is that okay? All the questions have been structured into various sections, clearly structured into sections. Is that okay? Great. That is fine. Now, let's come to the odd ones, retrospective studies. If someone is doing retrospective study, do you remember retrospective study design? What is a retrospective study design? What does it mean? If someone say I'm doing retrospective study, what does it mean?
The instead is when someone is making use of already existing data.
Good.
That's
You are
design.
you are doing a research and you are collecting data from an already existing information. Okay? Or you are doing research, you are collecting information from people from their past. Retrospective studies. Now, if you are doing retrospective study, what instruments can be used? We call it checklist. Write it down. If you are doing retrospective study, the instrument we use, we call it checklist. Is that okay? If you are doing retrospective studies, the instruments that we use, we call it checklist. Okay, so for retrospective studies, the instruments that we use, we call it checklist. Checklist. Is that okay? In retrospective studies, we call it checklist. Okay, good. The checklist let me show you example. So that one, you can't call it interview guide, you can't call it questionnaire. So those of you that you review past records, some of you, the topic you do, you decide that, oh, we want to review malaria cases admitted at, let's say, Dansoman Polyclinic between the year. Some of the midwives will say, oh, we want to look at pregnancy complications recorded at Dansoman Antenatal Clinic within the year 2023 and 2026. You can use that as a research topic. Now, in a study like that, your instrument, you use what we call checklist. Is that okay? Let me show you how the checklist look like. Let me show you how the checklist look like. Okay, so let's look at how the checklist look like. Okay. All right. So this is how a checklist looks like. So you see, look at this topic. Trend of sickle cell disease among teenagers, 13 to 19 years, attending the outpatient at Tema General Hospital. You see this topic, trend of sickle cell disease among teenagers, attending the outpatient department at Tema General Hospital. You see, very simple topic. Let's go to their objectives first. Let's go to their objectives. So you see the specific objectives. The specific objectives. To achieve this main objective, the study seeks to. So you see how they have written. The study seeks to. So the study seeks to determine. So there are two goals for all of them. The study seeks to determine. The study seeks to identify. The study seeks to. But this is not how we taught you how to do it. We taught you to write the two for all of them separate. Yes. So they have three objectives. Let's go to their instruments. You see, they have pictures. In research, you put pictures from the world where you went to do the research into the work. If you did a community study, you have to put pictures into the work. So, so look at it. So you see, they have retrospective data collection checklist. We call it checklist. That one, you can't call it questionnaire. We call it checklist. So it's like checklist to tell you that there are things that you are considering. So you check them. There are things that you are checking. So we call it checklist. You see checklist 2, the compulsory section is the section A. Yes, section A is compulsory. You see section B, hospital attendance. Section C, clinical information. Section D, hospital admission. You see how this section they are check? Yes, that's how we section. This one, we call it checklist. So when they pick a particular case, they will write the client ID or hospital ID. The person will search for the records for the person's age. Then they will take, if the person is a male, the record they are reviewing is a male, they will take male. Then they check year of OPD clinic attendance. Which year did the person come to the OPD? Then they will take, if it was 2023, the person had a crisis and came, they will take the number of visits per year. That very year, the number of visits they will take. Is that okay? This one, we call it checklist. So if you are doing retrospective studies, the instruments we use, we call it checklist. Is that okay? We call it checklist. Okay. Usually it's the same thing for if you are doing prospective study. That one you can use both questionnaire and checklist all together. So for people doing prospective studies, they can make use of both questionnaire. They can also make use of what? Checklist for those doing prospective studies. So now you know what checklist means. You know when we use checklist. You know what questionnaire means. You know when we use questionnaire. You know the type of questionnaire. Is that okay? Now we have another type of qualitative study. That one we call it the focus group discussions. When we say focus group discussions, sometimes you see qualitative studies, when you are doing the interview, it's one-on-one, it's one-to-one. So for example, if I come to your class and I want to use 10 people to do an interview, or I'm doing qualitative study, I want to use 10 people, I'll call all of you one face-to-face, one-one, then we are doing the interview, I'm recording. But you can have a type of qualitative study, that one, we call it the focus group discussion. So that one is like 5 people, it's like a meeting of 5 people. You are asking the questions and you are recording. That one is what we call the focus group discussions. Focus group discussions. That one, if you are doing that type of qualitative study, and it's not like a normal interview that is between 2 people, that one we call it focus group discussion. That one, the instrument, we call it focus group discussion interview guide or focus group discussion guide. Okay, focus group discussion interview guide or focus group discussion guide. Is that okay? So sometimes you see when you are doing interview, normally for interviews, it's one-on-one. You are sitting there, the researcher, the person is in front of you. You are asking your questions, the person is answering, you are recording. But we have a type of qualitative study. That one is not one person to one. It's about one person who is the researcher to about 5 people. Like more like a meeting. And that one person who is a researcher is asking the question and they are responding and the person is recording. We call that one focus group discussions. Now, focus group discussion is also qualitative studies. But that one, the difference is that it's not like face-to-face, one-on-one. It's like about 1 person to about 5 people. That one is also interview guide, but the best name for it is focus group discussion interview guide. Focus group discussion interview guide. Or you can call it focus group discussion guide. But fine, if you call it interview guide too, it's not a problem because it's a qualitative studies. But the best name we want you to call it is the focus group discussion interview guide. So for example, you see this instrument. Look at this instrument. Let's assume that you see these questions over here. You see these questions over here. Let's assume it's not a question that I'm going to use to do interview for one-on-one people. So me, the researcher, another person. But I'm going to ask these questions. It's like a meeting of 10 people and I'm asking all of them at once. Here, I won't write on top. I won't write interview guide. I'll write focus group discussion guide or focus group discussion interview guide. Is that okay? But it's the same thing. It's also an interview guide. The reason why we want you to call it focus group discussion guide is that because this time is focus group discussions. Is that okay? Yes. So know the dynamics. So let me ask you this question. If someone is doing retrospective study, what instrument is the person going to use?
Checklist.
Checklist. Excellent. Checklist. Okay, checklist. Okay. If someone is doing quantitative study, what instruments can be used? And which one is the best?
Structured questionnaire.
Good. Structured. Good. Excellent.
Unstructured questionnaire.
Structured questionnaire. Structured questionnaire.
With close-ended questions.
Structured questionnaire with close-ended questions. That is excellent. Any other?
Semi-structured questionnaire.
So structured questionnaire with close-ended questions, unstructured questionnaire, and semi-structured questionnaire. You've gotten it right. Okay, if someone is doing qualitative studies, what instrument is the person going to use?
Structured interview guide.
Interview guide.
Structured interview guide, that is one.
Unstructured
interview guide. Is that okay? And know the meanings of all these things. Know the meaning. When we say structured interview guide, know what it means. When we say unstructured, these are simple things that, remember I told you, most of your questions, MCQs, will be from the research methods. Is that okay? There's some few simple questions you've already practiced your hands on already on the section, in the section B. So please, these are things that you have to try, familiarize yourself with. So when we say structured questionnaire, what does it mean? Semi-structured questionnaire, what does it mean? And that's the meanings that I've given you. Is that okay? Okay. So now you know what data collection
Can you come
instrument
again with the unstructured interview guide?
Unstructured interview guide. Unstructured interview guide, it's not in any section. Okay, unstructured interview guide is not in any section. So if you take it, so this is a structured, look at this. You see, are you seeing sections? Can you see background information section A? You can see section B. You can see section C. If it was unstructured, I will list all the questions. One, you won't see me doing any. This one will not be there. You won't see this. You won't see this one there. You won't see this one. You won't see this. Okay, all the questions will be messed up once. So this one too wouldn't be there. Let me delete this one. This one too wouldn't be there. Then if it is 25 questions that I have, I'll all the 25 questions, boom, straight. You won't see me wasting time to put them into sections. You see, like this. You see what I've done? So you see what I've done? You see now all the questions. Then I will number all 1 to 25 straight. I'm done. It's not structured questionnaire. So it's not a structured interview guide. Okay. For a structured interview guide, you are clearly going to see all the sections. You are going to see that, okay, this section is for this objective. This section is for this objective. Is that okay? Like how we were having it previously. So you see here, we have section A. Section B is there. Section C is there. You see, all the sections are there. This one is structured interview guide. Is that okay? Structured interview guide. On structured interview guide, you are going to see all these sections there. And typically, a structured interview guide shouldn't deviate. You see, ideally, an interview guide, what type of questions are you expecting in an interview guide? Yes, what type of questions are you expecting in an interview guide?
Open-ended questions.
Good. So let's say you see this one. You see this one. This is an assuming this is an interview guide. Then look at the age. I come and put this there. 15 to 20 years. Then I put 21 to 30 years. Automatically, I've made it unstructured. So that's why I say understand the dynamics. It's not only about the sections that we use to say is structured or unstructured. The deviations too. So the ideal thing is that in a typical interview guide, what type of questions are you expecting? Open-ended questions. Then the researcher will go and put one question B with close-ended questions straight. The person have made it unstructured. So it being structured, it's not only about the sections too, the deviations. Okay, so look at this. So for example, you see this last question. Look at the last question. Then the last question here, I come and give them options. I've deviated. That the deviations too can qualify it to be called unstructured interview guide. Not only about the sections, but typically it's the sections that we use. Okay, but the deviations too. So for example, let's go to this person's instrument. Let's go to this person's instrument. Look at these questions. So you see these questions, all of them, there are sections, meaning structure. Then let's assume that at the ending of this research, you see at the ending, and you see this, probably people have not paid attention. You see, sometimes they'll bring questionnaire to you. All the questions are close-ended. Then they'll put, what do you recommend? Do you get it? Having to see something like that, then they put dots. Then they're expecting you to write something there. They've made it unstructured. Is that okay? So the unstructured meaning they've deviated. Okay, but the moment you see more of open-ended questions, then they are making it more like an interview guide and a questionnaire. Then that one, it should tell you, it should inform you that then they are probably doing a mixed method study. But when you see just one deviation, so all the questions are close-ended questions, then just one question, open-ended, is unstructured. So it being unstructured is not only about the sections. The deviations too can make it unstructured. Is that okay? So for example, let me go back to, yes, ask your question, young lady. Ask your question, please.
Sir, please, so where does the semi-structured questionnaire comes in?
Okay, so when we say a semi-structured questionnaire, semi-structured, it means the person has decided to use, one, semi-structured, one, the person is not structuring it into sections. Two, the person have decided to use comfortably both close-ended and open-ended questions. Then the person is doing semi-structured. Okay, even when it is a quantitative study. So you say semi-structured, the thing is a quantitative study, meaning they are using questionnaire. You know, questionnaire is the accepted instrument for quantitative. And for quantitative, the standard, what are we expecting? The standard we are expecting is that they will do what we call questionnaire with close-ended questions. Now, you have someone who is comfortably, one, probably not sectioning the work. And two, the person is comfortably using both close and open-ended questions in a quantitative instrument. That is a semi-structured. Okay, but when we say the unstructured, it means that, so the unstructured, probably you see the questions, they are not in sections. All the questions are not in sections. So you see, it's a mixture. They've missed it. So you see, you not see the sections. It's like all the questions, they've listed all of them. Okay, they've listed all of them. Let me show you an example. Let me show you a research. Let me see whether I'll get a research with that example in there. A mixed method study. Let me see whether I'll get a mixed method study for you. Okay, let me see. I think I should have. Should have an example of just hoping this one is no mixed method. Okay. So electronic. Okay. Yes, let's look at an example. So this is a typical example. Okay, so which one is this one? Oh, this one, did I make it a mixed method? No, I don't think so. Okay. Mentorship. Okay, yes. Okay, good. So, okay. Yes, so this is fine. Okay, let's go here. Okay, look at this instrument. Look at this instrument. Let me start from the top. Look at this instrument very well. And tell me which. Look at this instrument very well. Pay attention to the instrument. I'll go over it. Then you tell me which type of instrument specifically whether you think it's a structured questionnaire, semi-structured questionnaire, look at it very well. So let me start from the section A, demographics. I'm going over it. So look at the section. Look at question 1. Look at how question 1 looks like. Look at how question 1 looks like. Okay. Look at question 6. You see how question 6 look like? Look at how question 6 looks like. I'm giving you a picture of some of the questions, how they look like. Look at question 6. Look at question 9. Look at how it looks like. Look at question 10. Okay. Now let's come to, okay, here we have options. So look at question 1, all of them, there are options. Look at question 4, all of them, there are options. So here, all of them, options are there. Here too, all of them, options are there. Okay, so look at this one too. So you see here, we have an interview guide here. Now, the first question I want to ask is that, what type of study do you think they are conducting here? What type of research do you think they are conducting here? Let me start from the top again. There is a questionnaire here, and then again, there is an interview guide. What type of study do you think they are conducting here? Yes. Yes.
Qualitative and a quantitative study.
Yes. So what type of study it is are they conducting?
Mixed.
Oh, that is what I'm expecting. It's a mixed method study. Now, the questionnaire part, the questionnaire components, what type of questionnaire do you think they have here? Look at the questionnaire. It's a semi-structured questionnaire. Why is this semi-structured? My sister, can you explain? Why is this semi-structured? You are right. Why is this semi-structured?
They both have closed and open-ended questions.
Come again, I didn't hear that part.
They both have closed and open-ended questions.
Oh, but that is not the idea. The point is that it has both structured, both closed and open-ended questions. But you see, the point with semi-structured is that there is a few of the questions that have deviated from the norm. So you see, look, you can count a lot of questions that are closed-ended. Check. Look at question. It's only question 1, question 6, question 9, question 10. Apart from that, all the questions are closed-ended. That is semi. So you see, there are just few questions that makes it deviate from the normal structured questionnaire. So the normal structured questionnaire, we are expecting closed-ended questions alone. But you see here, just few questions. So you see only the age. They've given option for you to write your age there. They didn't give you the age for you to select. If you come, you see the program they didn't list the program for you to take. If you come here to the GPA, they've left the space for you to write. So here it's a semi-structured questionnaire. Is that so? So what makes it semi-structured? It's just a few of the deviations. What are the deviations? The deviations are the points that they've allowed open-ended questions for some of the questions in there. Is that okay? But when we say something is unstructured questionnaire, the unstructured questionnaire is not going to be few deviations. So the deviations will be more. It's like anida. That's what you people use the word anidahopa. Nanidaho. Unimpasa then is supposed to be close-ended, but what said that chim they half and it mean kase anidaho. You get that? Then that one it becomes unstructured. That's why we use the word unstructured. But you see, the semi-structured is in the favor of the structured. So the semi-structured, majority of the questions are close-ended. Then a few deviations. But the unstructured, the person knows. You know that quantitative is supposed to be structured. You know it's supposed to be close-ended questions. But we look at your research, then about half of your questions, even though it's a questionnaire, but about half of your questions are open-ended questions. It's unstructured. But that is not the only way to explain the unstructured. Again, the sections are not so clear. So you see here, section A is clear, section B is clear, section C is clear. You see, all the sections are so clear. Is that okay? But apart from that, there are just a few deviations that are open-ended questions. There are no more. You can count 1, 2, 3, 4. Just 4 questions. But let's have someone who is having a question. Let's say 20 questions. The 20 question, the person have titled it a questionnaire, but about 10 of the questions are open-ended questions. You can call it a structured, that is an unstructured questionnaire. But not only that, let's say the questionnaire, if the person's questions are 30, all the 30 questions straight, no sections, that one too is unstructured. Is that? So when we say semi-structured, that one is good. Meaning once we've used the word structured, it means the sections are there. But that one, just some few of the questions that there are deviations, some few of them. So let's say if section A is having 5 questions, then the researcher, one question, they've written the question and they have left space for you to write something there. Is that okay? That one is what we call the semi-structured. So you see the semi-structured, we are still using the word structure. So the point comes with the few deviations where the person is having is introducing some open-ended questions in the work. Is that okay? Yeah, so now I think you are good with the data collection instruments. Okay, data collection instrument. Okay, so know the instruments we use for qualitative studies, the instruments we use for quantitative studies, and the subtypes under it and their meaning. What instrument do we use for retrospective studies? These are very simple things. Okay, what instrument do you know is checklist. Once you see checklist, you know that is the answer. What instrument do we use for prospective studies? Yes, what instrument do we use for? Good, excellent. Yes, excellent. Questionnaires and checklists. Yes. So for prospective studies, you can use questionnaires and you can use checklists for prospective studies. So basically, this is what we call the data collection tool. So now you see, we've done the theory. What we've done is just about you knowing it. But the point is the practical work. Now we are going to discuss the manual. So the point is, if you are doing research and you get to the data collection instrument, this part. So let me open someone's research. You get to the data collection instrument. How do you write there? So now that we are going to discuss that. And that's what makes research interesting. So it's one thing knowing the theory part. And it's another thing when you are writing project work and you get to data collection instrument, how we write it. They are different things altogether. Is that okay? Good. So you see, this is how we title. So you see data collection tool. So this is someone's research. So you see, when you get to this section, we title it data collection tool. Let me copy what do you think should be the, so here you can write it. Let me see the word count for you. Let me check the word count. Let me give you a good word count that you can use. This is more. If you are writing the data collection tool, you can write it in about 150 to 250 words. If you want to do one paragraph, it's fine. 150 to 250 words is okay. Don't write beyond 250 words. Okay? Yes. So if you want to do 2 paragraphs, you can write, let's say, first paragraph, 120 words. Second paragraph, let's say, 130 words. Okay, that's if you want to do 250 words. But you can also write it between 150 to 250 words. It's allowed. Is that okay? It's allowed. Okay.
Sir, please, can you come again with the word count?
Yes, I said you can do 150 to 250 words. So you see, this person, you can do, so I said you can either do 1 paragraph or you can do 2 paragraphs. It's accepted. If you are doing 1 paragraph, just limit yourself to about 150 words. If you are doing 2 paragraphs, then the first paragraph, you can do, let's say, 120 words. The second paragraph. So like this person, for example, you see the first paragraph, the person is doing about 150 words. Then the second paragraph, the person is doing about 150. Okay, so the first paragraph, the person is doing, you see, this is 130 words. This is the first paragraph. Then the second paragraph, let me look at the second. See, the second paragraph, the person is doing about 140 words, but this is more. The first paragraph, you can do about 120 words. The second paragraph, you can do about 130 words. Then it becomes 250. Or you can do straight 1 paragraph, 150 words. It's fine. It shouldn't be that more. This person have written a lot for data collection instrument alone. It's too much. Okay. Now, how do we write it? Now, remember, before you are doing this data collection instrument section, please write it down for your group. Before you get here, you've designed your questionnaire already. Now here, what we are going to do over here is you are basically going to describe your instruments. So for example, if I was part of this researcher, before I'll get to this data collection 2, this part in the chapter 3, you and your group members have to design your questionnaire first. Either than that, you can't do that section. So you see, here you are just going to look on this and describe. So you are going to say, okay, data collection 2 that was adapted for this study was this one. Is it a structured questionnaire? Look at it. Is it a structured questionnaire or semi-structured or unstructured? Look at it very well. This one, is it structured? Yes, this one is structured. Good. So you are going to write the data collection instrument that was used for this study was a structured questionnaire with close-ended questions. After you stated that as your first sentence, then you define what a structured questionnaire means. Then you explain why you are saying close-ended questions. Then you tell us why it is important. It's important. Structured questionnaire. When do we use structured questionnaire? Which type of studies do we use structured questionnaire? When you finish, then you come and tell us. You have to tell your readers how many sections do we have. So this study, how many sections do we have? Check for me. How many sections? Section A, Section B, Section C, Section D, Section E. How many sections do we have? Yes, how many sections do we have?
5 sections.
Yes, 5 sections. You have to state it in the description under the data collection 2 that your questionnaire, your structured questionnaire consisted of 5 sections. Then you even have to state it one after the other. Section A focus on, then you tell us Section A focus on demographic characteristics of respondents. Section B focused on what? Nurses' perception of strategic leadership practices. Is that okay? Section C focus on, so let's go back and see what they've done. You see, it will follow the same pattern. Okay, in research, if you know how to do at any point in time, it's one of the easiest things to do. If you know how to do at every step. So you see what they are doing. So you see, data collection 2. You can even define data collection 2 if you want. It's like the definition I give. Data collection 2 is a device that a researcher used to collect information or obtain information from participants. You can do that, it's accepted. Now, when you finish with that, you see here, for this study, a structured, you see they've written, a structured self-administered questionnaire. That one is not anything new. When we say structured self-administered, it means it's a structured questionnaire. But the researchers, they gave it out themselves. You see, those people that they give the researchers to your course rep to bring, they are not doing self-administered. It's people that are administering. When you say self-administered, it means you give it out and stand there for them, guide them to fail. And that's the best thing to do. So when we say structured self-administered questionnaire, what it means is that the self-administered means you, the researcher, will come and issue it out to people yourself and observe them for them to complete it. That's when we say structured self-administered questionnaire. Is that okay? So you see, but here, if you like, you can decide not to even bring the self-administered. But if you bring it, it's nice. So for this study, a structured self-administered questionnaire will be used to collect what? Quantitative data from nurses and nurse leaders at the Trauma and Orthopedic Department of Korle Bu Teaching Hospital. The questionnaire would consist entirely of what? The questionnaire will consist of what? Close-ended questions. You see, they've stated it over there. You also have to state it. So you see, it's like they are describing what is in the questionnaire. That's why I'm telling you, before you get to this point, you have to design your questionnaire first. Else you can't do this place properly. Is that, in fact, some supervisors, in research, we even advise that the moment you confirm your specific objective, automatic, you have to design your instruments. That's the best thing to do as a researcher. So anytime you are writing research, the moment you confirm your specific objective, the next thing to do is to design your questionnaire. That's the best thing to do. Is that okay? Okay, so before you get to this point, so you see, look at what they've done. The questionnaire would consist entirely of close-ended questions developed based on what? Objectives and relevant. And that's what you have to do. That's what we were discussing earlier on. That your data collection instruments have to align with your objectives. That's what they are saying. that the questionnaire was designed in alignment with their objectives. You can also say that it's allowed. So you see, the questionnaire will be divided into 5 sections. Look at, you see all the sections are here. The questionnaire will be divided into 5 sections. Section A would cover demographic characteristics of respondents. Okay. Section B to E would assess perception of strategic leadership. Strategic leadership, but don't do it this way. State all separate. This person is trying to do lazy work. You see, they say section B to E. No. Say section B will focus on this. Section C will focus on this. Section D will focus on this. And lastly, section E will focus on that. Don't say section B to E. No. Do all of them separate. Is that okay? Let me see whether this person have done something important. Let me see how this person describes their own, whether it's the best. So look at their own. Look at this people's own. The data collection tool for this study will be structured. So you see, once you see the written structured, what will it tell you? Is it quantitative study or qualitative?
Quantitative.
Good, quantitative. So you see, the data collection tool for this study will be a structured questionnaire, consistent primary of what? Close-ended questions. Is that okay? So structured questionnaires are widely acknowledged. So you see, they are defining structured questionnaire, what it means. Okay, so you see, questionnaire will be developed in consultation with our supervisor. You can also write it. Your write-up very beautiful. And your questionnaire will be developed in consultation. You can say questionnaire will be developed in consultation with experts in questionnaire development. It's nice. Yes, you can say when you are developing a questionnaire, you consulted experts in that topic. It's also good. Or you consulted your supervisors or your research tutor or whoever, or maybe a lecturer. You can say that it's allowed. Is that okay? Again, look, you see, it will be organized into 4 main sessions. You see how it goes. The first session will collect social demographics. That's the compulsory section. This person have done the right thing. The second session will assess. You see, they've done for all. The third section will be awareness. Examine attitudes and by this. You have to talk about what session, what looking on the question describing. Let's go to their questionnaire. It's not something difficult to do. That's why you have to design your questionnaire first. So you see here, you can see clearly this is a structured questionnaire. So you say, oh, the first section would focus on demographic and obstetric characteristics. The section B focused on knowledge of resource factor incompatibility. So it's not like you are doing something from, it's there already from what you've designed, the instrument that you've designed. You are just looking on it to describe it. That's what we mean by data collection. So first of all, what do you have to do? You have to define what data collection procedure means. Then you tell us which instruments you used. Okay. If you are using interview guide, you have to state that for this study, the data collection tool that will be adapted is an interview guide, or you can say a structured interview guide with open-ended questions. Then you define what structured interview guide is. You explain what open-ended question means. Then now you come and tell us the interview guide was structured into 5 sections. Section A consisted of demographic characteristics. Section B consisted of this. Section C consisted of that. Question D consisted of that. That's how we go. Is that okay? That's how we go. So now I believe you've gotten how we do the data collection procedures, right? The data collection tool. Sorry, the data collection tool. Are you okay with that? Please, are you okay with that? Good. So I think with this being said, I think it's very good for us to end over here. Is that okay? It's very good for us to end over here. Okay, good. So today we've done data collection instruments. Now, our last meeting